Mahmuda. I'm one of the medical students on the team.
Nice to meet you.
How are you doing today?
I'm doing pretty well.
Okay, and how's Matt doing?
He's doing about the same.
Okay. So today I'm going to be presenting Matt to the rest of the team, if that's okay. If at any point you feel like there's any mistakes or you'd like to add anything, please feel free to jump in.
Thank you.
Okay. So today we'll be presenting Matt. He is our 6-year-old with past medical history significant for allergies, asthma, and eczema, presenting with acute left leg pain and fevers. Matt was in his usual state of health until 2 days ago when mom saw that he had fevers, which have been resolved with Tylenol and ibuprofen, but they keep coming back. Matt has symptoms of cough and congestion several weeks ago due to some sick contacts from his daycare, but he denies any trauma. He's usually an active kid, but because of his leg pain, he's been unable to walk, and his mom has been carrying him around everywhere. As for his medications, he's on albuterol, Tylenol, and ibuprofen for the fevers. Allergies, he's allergic to shellfish, tree nuts, and no allergies to medications. Family history is significant for a brother who has febrile seizures, which is something mom is concerned about, and a sister who has sickle cell. Social history, he lives with his mother and a 7-year-old brother and 3-year-old sister, and he is in 1st grade. For a review of symptoms, he has a fever, he has his leg pain, decreased appetite, but it's negative for cough, congestion, shortness of breath, abdominal pain, vomiting, diarrhea, or rash. As for the physical exam, vital signs include he's febrile with temperature of 39.5, heart rate of 120, respiratory rate of 18, blood pressure of 95/50, and oxygen saturation of 100% in room air. In general, he's fussy and he keeps crying when his mom moves him at the bedside. For HENT, he's atraumatic, normocephalic, extraocular movements intact, pupils equal, round, and reactive to light, nares are patent, and the pharynx has no erythema or exudates. Neck is supple, full range of motion, multiple 0.5 centimeters to 0.5 centimeter lymph nodes palpated over the anterior cervical chin. His lung and heart and abdominal and neuro exam are within normal limits. As for his MSK exam, he's lying supine with the left leg externally rotated and abducted. He refuses to move his leg and has severe discomfort even with minimal internal and external rotation of the hip. He has full range of motion of his other extremities. In his skin, it's dry, flaky skin over extremities. As for his labs, he has CBC, white blood cell count of 20, 80% sex, 10% bands, and 8% lymphs, and 2% monos, hemoglobin of 14, hematocrit of 43, and platelet of 265, ESR of 45, and CRP of 12. Imaging was done of his left leg, which showed X-ray. The X-ray shows hips. The hips showed widening of the acetabular space on the left. Just for impression, so Matt is your 6-year-old with past medical history significant for allergies, asthma, and eczema, presenting with acute left leg pain, leukocytosis, fevers, positive CRP, elevated CRP and ESR, and a positive X-ray representing widening of the acetabulum. Given the information, it's most likely that Matt has osteomyelitis due to the leukocytosis and the acute left leg pain. After several weeks of URI symptoms, we should probably get a culture of the synovial fluid and see what's growing there, if there is. And one of the other concerns would be to check for sickle cell trait, given his sister has sickle cell. It's possible he probably has a vascular occlusion or something, but that would be further down in the differential. But is there anything else that you'd like to add?
No, I don't.
Okay, great. Well, great.